Welcome to this video. I've previously talked about the difference between general depression and a depressive disorder, and now I'm going to be talking about the problem with treating depression. All forms of depression include the symptom of avolition. This refers to a lack of motivation or the inability to initiate and persist in goal-directed behaviors. This avolition makes it very tricky to treat depression, as the two main treatments for depression are cognitive behavioral therapy, CBT, and drug treatments. Firstly, focusing on CBT, individuals with depression must want to go to the therapy and actively take part in the treatment method, whether it be homework, patient as scientist, etc. This is inherently faulty as depression involves a lack of motivation, so it's very difficult for them to seek therapies if they are unmotivated to do so. On the other hand, there are drug treatments such as antidepressants. These are great because patients don't need motivation to take a pill or liquid, and some can apply relief quite quickly. However, with all the strengths come the weaknesses of drug use. For example, the drugs can create a dependency for the patient where not only do they believe that they need them all the time, but it may also lead them to ignore other treatment alternatives like talking therapies. There is also a third option for the treatment of depression, both CBT and drugs. In fact, this is the most used treatment method for depression in the UK. This approach combines the strengths of both treatment methods and attempts to remove some of the negatives, as by doing both, the antidepressants can help improve motivation for the patient to involve themselves in the therapy. Despite all this, it all comes back to the avolition of the individual. If they are so unmotivated that they find it impossible to function adequately, such as in severe cases of MDD, major depressive disorder, they may not even seek treatment in the first place, let alone choose between drug treatments or CBT. Overall, the issue with treating depression stems from the depressive symptoms themselves, which make it very difficult for sufferers to cope with everyday life, and drain them of their motivation to want to change, unfortunately trapping them in a sort of depression cycle.